Welcome to our podcast this evening on the future of healthcare in Pakistan. First, let's visit the United States. The United States has an excellent healthcare system. They have insurance programs for those that are working class and for those that live in poverty. There are also charitable organizations that help with medical bills. In the United States, you're not allowed to turn someone away from a hospital if they do not have insurance or if they do not have money to pay the bill. I do not brag. I want us to compare this system with the system that is currently in place in Pakistan. In Pakistan today, there are roughly 197 million people. Having a healthy workforce is vital to the strength and the future of the nation. What does the Pakistani healthcare sector get right? Well, the best that they have is the private healthcare sector. The private healthcare sector is not ran by the government. It is privately owned and operated. Those that use this are those in the upper middle class and the upper class. Private healthcare accounts for 3/4 of the healthcare services provided in Pakistan today. For those that can afford private healthcare and live in urban areas where these facilities are, do very well with their healthcare. But healthcare is a different story if you live in a rural community. For example, most children in Pakistan are born at home with a lady healthcare worker. This is similar to a midwife. Newborn babies and their mothers are a very vulnerable population. The mortality rate in Pakistan is 45.5 per 1,000 live births. And for the mothers, it is 81.1 per 100,000 live births. The main difference is the ability for women to be able to get to a hospital if she needs it. If a woman were able to get to one of the 945 hospitals in the nation, she is not guaranteed to be seen by a doctor. There are only one doctor per 1,225 people in Pakistan. The Pakistan government provides about 24.4% of health care expenditures. There is no health insurance for children, and there is no Medicare or Medicaid. But one of the biggest problems facing Pakistan healthcare system is the lack of doctors, nurses, and medical facilities. So what about the future in healthcare in Pakistan, you say? The future in Pakistan is not bright. According to the Transparency International, health sector in Pakistani government is the third most corrupt department. Also negatively affecting the healthcare system in Pakistan is the fact that the government has not had a current healthcare policy since 2002. Obviously, Pakistan is not the same nation it was in 2002. There have been 3 different government changes since that time, but the biggest blow to the healthcare system in Pakistan is the 18th Amendment. This constitutional amendment is the federal government's way to try to restore some provincial powers taken away from them by Musharraf and Zia. The 18th Amendment took the Federal Ministry of Health and dissolved it. The Pakistani national government gave the power to the provincial governments. So how is this going to work? No one knows. The provincial governments are trying to figure that out themselves and how they will handle this responsibility. It also leaves the provincial governments with no checks and balances and no regulations for the private sector. It also gives a shortage of resources to the rural areas. Pakistan needs good, quality, accessible health care for all their citizens. Having no federal policies and no federal funding will only bring a larger divide between those that can afford private health care and those that cannot. Even the World Health Care Organization expressed concern over the dissolving of the Ministry of Health. Not only was the Ministry of Health dissolved, but so was the law regulating pharmaceutical sector in Pakistan. Today, the markets in Pakistan are filled with fake pills. The future of healthcare in Pakistan is very troubled. With no oversight and no funding and corruption, this can mean that more Pakistanis can become sick and die from the lack of health care. Thank you. Please visit us next week when we talk about the schools and what the 18th Amendment means to them.